So the concept of cure is very important, of course, because that's the most important question patients ask: can I be cured? So what evidence is available? Now, one of the first descriptions of a myeloma patient comes from Prague, from Otto Keiler, who followed a patient who was himself a physician, and that was in 1880. So the patient survived for 6 years without any specific anti-myeloma therapy. So there was some indication that myeloma has many phases, and you have to, of course, if you look at patient populations who have a high likelihood for cure, you need to use, of course, very effective therapy, and you need nowadays to check for MRD negativity. But it was already 2014 that Bart Balogi published a paper in Blood about cure rate in his patient groups with receiving total therapy. And he followed his patients for 25 years. So he showed clearly that there's a cure rate varying between, I don't know, 7 to 15%. But these are patients who had, at this time, no genetic abnormalities. He used gene expression profiling, and patients who were younger and received total therapy. Nowadays, we have patients which receive excellent therapy and which we can cure. So the IMS defined what they call functional cure, which implies that the patient has to be 5 years MRD negative to have a high likelihood for being cured. But the true definition of cure is a patient has to get, you have to get rid of all the myeloma cells in the patient without any further therapy. Patient's symptoms have to resolve completely, and the patient must have the chance for long survival, which should be similar or better than the survival of age-matched normal people. So that is cure.